Do you know medical injections could take your life in seconds? Anaphylaxis is an emergency and dangerous allergic reaction in human body. Although it is a very rare condition in humans. But if it occurs, the patient has only a couple of minutes to survive by a series of emergency services in a medical center like CPR. Anaphylaxis always has a triggering factor. This factor could be a medicine, especially injection forms, some kind of food like peanuts or shellfish, and a few other things, like insect stings or natural latex. Symptoms usually develop suddenly and escalate in seconds. Swelling of the lips, tongue and throat, skin hives and generalized itching, bluish skin, difficulty breathing, wheezing, coughing, rapid heartbeat, heart palpitations, nausea and vomit, abdominal pain or cramping, confusion, diarrhea. The most common triggering factor is medication, especially in injection forms. It is highly recommended any kind of medical injections including antibiotics, muscle relaxants, painkillers, vaccines, and even a simple vitamin must be done in a medical center rather than home. People with allergies, asthma and heart problems should be considered as high-risk category. Although other triggering factors such as food, insect sting and natural latex are not as common as medications, but if the body reacts to them severely, you must consider them as an emergency condition too. To find out if you have an allergy leading up to anaphylaxis, you may need some medical tests like blood or skin tests prescribed by the doctor. Epinephrine, also known as adrenaline, both in nasal spray and injection forms, is the first-line treatment of any severe allergic reaction. For anaphylaxis, it is very important to take the patient to an emergency department as soon as possible or call an ambulance. Epinephrine for the first time should be used under the doctor or emergency staff guidance. But if you had an anaphylactic reaction once before, you should have an auto-injector. Anaphylaxis is a rare condition, so you don't have to be worried about every medication you take or every food you eat. Just remember, do not inject medicines at home. Some group of people are considered as high risk, like patients with asthma, previous severe allergy reactions, heart problems, and autoimmune diseases. In severe cases, emergency medical actions like CPR or heart monitoring will be performed in the hospital. But it is absolutely essential for the patient to reach the hospital as soon as possible, especially when the triggering factor is a medicine. Thanks everyone for watching. Stay out of trouble. And don't forget to subscribe our YouTube channel for more amazing medical facts.